All right, so I'm going to be talking a bit about how to manage anxiety when somebody in your family, in your household, tests positive for COVID. Super relevant, and unfortunately, something I have a little bit of experience with now. So, my husband tested positive for COVID a week ago. He developed symptoms about 10 days ago. Um, we don't know, how he got it as he's working from home, only leaves the house for essential, shopping or occasional haircuts, things like that. As far as we can tell, we were doing everything right. So, um, biggest things to kind of keep in mind with this is that having a plan is going to help combat some of your anxiety. Not going to help all of it because, again, if if you're not anxious in this sort of situation, then I would say, that's great, but that's not most people, right? So it's normal. I want to normalize the fact that if you are dealing with a family member in your household who tests positive for COVID, it is normal to feel anxious, worried, tense, maybe even panicky. Now, things that you can do to reduce that. Biggest thing, have a plan. As soon as somebody is exhibiting symptoms, for most people, that's going to be cough or cold sort of symptoms. As soon as that first cough comes out, that's when that person should be isolated and quarantined into a separate room in the house. Ideally with access to a separate bathroom if possible. That was kind of our big mistake. We, I think, had a little bit of COVID fatigue in that we've been so careful every time this past year when either of us have, gotten sick that we had overdone it. And then I think this time we didn't really take it quite so seriously because it seemed pretty mild to begin with, just a little dry cough. After, an evening of that around the rest of the family, it was enough. So, having that plan, what to do, how you're going to manage when one member of the household, often a caregiving member, is out of commission is going to be huge. Um, Making sure that you have supplies is also going to be something that will be helpful for you. I'm not saying you should go out and stockpile things. Most people probably have enough toilet paper now, or you can order it, but it doesn't hurt to think about having at least a 10 to 14-day supply of essentials. Mainly because certain things, might not be easily accessible via Amazon, things like that. But also, you want to not have to worry about those things and running out of things that you need when you're dealing with illness in the household. You kind of want everything to be there at your fingertips at the ready for when you need it. I would recommend having, a supply because once somebody in your household is infected, at least in the state of Massachusetts, we're adhering to the 10-day rule. So 10 days from the outset of your symptoms is when you can come out of your quarantine. However, if another member of your family tests positive after that, your clock gets reset. So my husband tested positive, a few days after he came down with symptoms. So he's now coming out of his 10-day quarantine today. I tested positive yesterday with my symptoms starting last Friday. I got my test results. I got symptoms on Friday, got tested on Sunday, got my test results back today. So technically my 10 days is now up as of Monday. But luckily my toddler somehow tested negative. So we're getting her tested again tomorrow with a rapid test to see if she's still negative. And if so, we might try to hand her off to somebody else. But as of now, it should be fine to have my husband taking care of her, keeping in mind again that after 10 days, you have only a 5% chance of transmission, and he'll be wearing his, N95 mask and washing his hands. So we're hopeful maybe she'll stay negative. That would be, great. So that game plan really going to be helpful, having adequate supplies and having friends and family who can drop off ready-made meals, food. That really decreases stress, which is going to decrease anxiety because let me tell you, especially for any moms with young kids out there, it's hard cooking while you have a toddler or a young child running around and you're trying to keep some distance and you're wearing a mask and, it's hot over the stove. So, anything you can do to make things easier, like this, if this is any week that you want to, order out for every meal, this is the one. You can do contactless, have them drop it off at your front doorstep. Anything that makes life easier this week is going to be key. Now, other things that can help, making sure that you understand that this week is not like other weeks. You're not going to be on top of all your normal stuff, and the house might be, messy. That's fine, because really the biggest concern at this point is that things are sanitized. So if some of the stuff is cluttered, or if there are dishes that are in the sink, that's not necessarily the biggest issue. Making sure that the high touch points in the house are sanitized and with an appropriate sanitizing agent is going to be far more important than, having a spotless floor, things like that. All the more power to you if you can get all that done. But, sometimes being okay with the concept of good enough is going to apply even more during COVID times than normal. So the concept of good enough is something that I use often with patients with anxiety, because people who are anxious tend to have perfectionist tendencies, not all the time, but sometimes. And so oftentimes it can be very activating for your anxiety, thinking that you haven't done something exactly perfectly or exactly how it should be. And so being okay with doing good enough can be really helpful. You got to give yourself a little extra grace when you're dealing with COVID in your household. Other things that I would say in terms of helpful to decrease anxiety, trying to, get as much sleep as you can, trying to still take care of yourself, exercise if you can find the energy and time to do it, getting outside of your house if you can do so safely, go for a walk if you can do so in a manner that does not put others at risk. I've been taking some evening walks when I know that I'll have very little risk of running into neighbors while I'm masked, and that was actually recommended by a doctor to get out and walk and try to stay active. Other things that you can do would be diaphragmatic breathing. So this is kind of belly breathing. When we tend to get anxious, we tend to kind of hold our tension in our chest. Sometimes your breathing might be kind of, more shallow or more rapid. Things that can help are this deep breathing exercises. So the best way to do this, I find, is if you put your hand at the very top of your rib cage, you can kind of feel this exercise working best. But what you typically do, and bonus points if you do this with your eyes closed, is you take a nice deep breath in for a 4 count through your nose. So 1, 2, 3, 4. And then breathe out through your mouth slowly for a 3 count. So 1, 2, 3. So you do that about 4 times, and that's going to be something that can really help in terms of managing some of your anxiety symptoms. Other things that you can try to do, another thing that I like is progressive muscle relaxation. So this is progressively tightening your muscles in different muscle groups, moving up your body from your toes. So you start with your toes, you tighten your toes, then your foot muscles, then your calf muscles, your quadriceps, your glutes, your core, your shoulders, arms, hands, and you squeeze everything real, real tight together at the very end, and then you release everything all at once. And that should bring a wave of calm over you. Last but not least, if you are really getting into a bind where the worrying, anxiety, panic are unmanageable, phone a friend, phone for help, right? So you still have your social support networks, even if you can't see them. Talk with loved ones, talk with friends, call a help hotline in your area, call your PCP if you're really struggling. They might be able to call in a medication for you should you need it. And you can usually get medications delivered now. There are lots of different online mental health applications. So for instance, you can sign up for one of those. I think sometimes they even have free trials for, like BetterHelp or one of those sort of online therapy tools that are usually available, ASAP. Otherwise, see if you can get in to see a therapist. So that's a psychologist, clinical social worker, mental health counselor. Usually takes a little bit more time to get in with those, but see if you can find somebody to talk to. Sometimes just talking about your anxiety can be a really powerful tool in helping you feel a bit better. So I hope that you've found some of these anxiety tips to be helpful. And, knowing that you're not in this alone, a lot of other people are dealing with this. And most people will have mild cases of COVID is something that can be helpful to keep in mind. And stay tuned. I'll kind of talk next in my next video about how to deal with anxiety if you test positive yourself. All right, take care, stay safe.